All right, very warm welcome and welcome back. Ladies and gentlemen, we present you the next session post lunch for day 2. So, here we begin. The topic is the bullseye staying focused. And we have two very interesting personalities who will shed enormous light on this current topic. This program is been sponsored by IGL, Interpersonal Gas Limited. With that being said, ladies and gentlemen, please join me in welcoming Dr. Arvind Kumar Pandey, Associate Professor, Department of Anatomy, Kasturba Medical College, Manipal, India, and also Professor Samir Kumar Praharaj, Head and Professor, Department of Psychiatry, Kasturba Medical College, Manipal, India. I would also like to invite Dr. Arvind Kumar, Assistant Professor, Department of Psychiatry, All India Institute of Medical Sciences, Patna. So, Dr. Arvind Kumar, welcome, Dr. Arvind Kumar Pandey and Professor Samir. All of you welcome. I see smiling faces, and now is the time where Dr. Parmar takes the main stage. Over to you, sir.
Thank you so much, Anirudh. So very warm welcome to you all. Before wasting too much of time, let me introduce you all to the today's topic, which is something quite interesting and something really important in today's world. Staying focused in this world of technology, where probably most of you are having one distraction in your hand right now. So let us kind of hear from our eminent speakers, and let us see if their talks would help you kind of get away from your distraction in the form of your smartphone. It is something really important, especially for the medical students. So let me introduce you to the speakers for today's session. Dr. Arvind Kumar Pandey, who is an associate professor in the Department of Anatomy and a faculty in the Department of Medical Education at the Kasturba Medical College, Manipal, Karnataka, which is an Institute of Eminence declared by the HRD Department, Government of India. He's quite enthusiastic about teaching, enjoys incorporating newer concepts, technology into the teaching and learning process. And he has multiple awards, teaching awards to his name, various presentations, research papers, several publications in national, international index journals, and he also caters to the personal professional growth of his students, which is quite interesting. He's also MAHE-FAIMER fellow and faculty coordinator of student affairs at KMC Manipal. And his primary areas of interest include medical education, student welfare, and clinical anatomy. So very warm welcome to you, Dr. Arvind Pandey, sir. It's nice to have you here for this particular session. And then we have another speaker today, Dr. Samir Kumar Praharaj, who is a professor and head of the Department of Psychiatry at the same Kasturba Medical College, Manipal, Karnataka. And he is the editorial board member of many peer-reviewed psychiatry journals. His area of expertise and he, as a research scholar, credits him with many publications in national and international journals. And he has many national, international awards, including Early Career Psychiatrist Fellowship Award at Dhaka, Professor Raghuram Distinguished Young Teacher Award by Indian Psychiatric Society, Karnataka Chapter, to enlist a few of them. So very warm welcome to Dr. Samir, sir, also. And without any delay, may I request our today's speaker, first Dr. Arvind Kumar Pandey, and then Dr. Samir Kumar Praharaj, to let us go through the journey of being focused in today's world. So over to you, sir, Dr. Arvind.
Thank you, Dr. Arpit, for nice introduction. And hello, everyone. Greetings from Kasturba Medical College, Manipal. Before I start my presentation, I would like to thank Dr. Kumar sir, Dr. Avdesh Sharma sir, Aditi, and whole organizing committee for their wonderful job and contribution for well-being of the society, especially in the case of mental health. I'm thankful to organizing committee for giving me the opportunity to talk on the topic, which is very close to my heart, and it is need of the hour, the bullseye, staying focused. So I'm going to discuss about the goals, list out the distractors, how we are going to be focused, and how we are going to follow a healthy lifestyle. So basically, if you don't have goal, if you have not identified your goal, it's very difficult to focus. It's like you are untargeted or misleading missile. We don't know where we are going. It's a very important point. Before we think that we have to be focused, we have to identify our goal. And goal is nothing but your conscious aim that required planning and effort to achieve it. So we have to dream big. We have to sit down and we have to identify our goal, and then we have to start taking action. Before taking actions, it's very important to stop talking about the stuff you want, start taking a step you want. So one of the major steps to become focused is to identify goal. So just I want to know how many of you have the defined written down goals, and I want you to write in the chat box and choose the appropriate option regarding your goals. That A, B, and C, just you can write in the chat box. It is A, it is B, or it is C. Which one is applicable to you? A option, I have not set any goals. I have some goals, but not well defined and written down. I have clearly defined written down goals. Just you write in the chat box what is appropriate options for you. Yes. Okay, so what we can see here, majority of our participants, they fall in the group A and B. And this totally reflect in our research also. When we have asked our research participants to reflect about this A, B, and C, and we'll be surprised to note that less than 10% of people have that clearly defined written down goals. And they all are healthcare professionals. So now you can imagine, if you have not defined your goal itself, we don't know what we have to achieve, how we are going to be focused. So first important point is we have to identify our goals and we have to set our goals. So generally what we suggest, we'll go for SMART goal. SMART goal means S is for specific, what you want to achieve. Like different sectors are there for your life. Like you want to achieve good thing in your health. You want to achieve something good in your relationship. You want to achieve in your career. You want to achieve something financially. So whatever point, whatever it is there in your life, you have to be very specific. You want to achieve this. Second thing, it should be measurable. M for measurable. We want, again, same times. Whenever you're setting your goals, make sure that you should know at this point how much you have achieved and how much is left to achieve. It should be measurable. And again, A, it should be achievable. It should not fix any target. It's not going to achieve by any ways. So be honest and set a target, set a goal which is achievable. Come for that R, realistic and timely. It's very, very important because we have very limited time. So whenever setting your goals, remember this SMART, that is specific, measurable, achievable, realistic, and timely. So basically, what I give you example here, like generally, we see like some first year MBBS students have come to our medical schools, and what could be his or her goals. Accordingly, we will see that. So this plan, whenever we are making, when you have already make a list of your goals, now we have to do what? We have to segregate it in the long term, medium term, and the short term. Just I told you, I'll give example of the medical students. Just he has or she has joined to medical school. The short term maybe what could be your internal examinations, sessional examinations, what you're going to achieve within 3 to 4 months. Medium term, again, we can give example like within a year, university examination, what you are going to achieve and what could be your performance. That is medium. And long term is, again, after 5 to 10 years of your schooling in medical schools, what is your target, what you want to become. So like that, as per your goal, we can shortlist and make short term, medium term, and long term goal. So just I told you, if MBBS student have joined to our college, and finally long-term goal, if you look into, just I'll give you example, like Indian medical graduate, we want as a competent physician. He or she wants to be a competent healthcare professional. So what he has to do? He has to be a good clinician. He has to be a leader of his team. He should be a good communicator. He should be a lifelong learner because he or she has to update himself and professional. So these 5 points is like important or core part of competent physician. And these all 5 points, these 5 things, whatever we are discussing here, it's not going to achieve within 1 day, in 1 month, in the 1 year. This is long-term plan. And for that, we have to invest, we have to work almost daily basis to see the final target. That is the bullseye target, what our topic is. So there are 2 terms are very important, distraction and traction. So we have to identify our distractions also, which is barrier, which is blocking your target. We are moving away from what you really want. And traction, that is supporting environment, your desire, your burning goals that move towards what you really want. So we have to very specific to identify your distraction, to identify your traction. And once we know this is my traction, this is my positive point, we have to nourish it, we have to nurture it, and we have to make it more focused. So now I want you to identify your distractors, what you think is blocking you to reach your target. Just write in the chat box. I'll give you 30 seconds. Okay. So lot of response we got. So same thing we had asked in our study when we were doing this study regarding the distractions, our students, faculty. So we got almost 18 type of distractors. So just we can note it down here: social media, mobile internet, poor health, fear, stress, interpersonal relationship, finance, over workload, poor time management, present environment, workplace, friends, colleague, alcohol, substance abuse, loss of self-confidence, feeling incompetent, homesickness, family background, fear of missing out. And out of this 18, which one was like more or common where, like social media, mobile internet, stress, interpersonal relationship, poor time management, alcohol, substance abuse, homesickness, fear of missing out. And believe me, all these distractors, behind all these distractors, 3 to 4 points are very, very important. That is, if you have lack of your burning desire, you have not set your goals, if you are not disciplined, and you have low willpower. And last, but very, very important, that is unhealthy lifestyle. So these four things are almost leads to this all type of distractors, what are we have listed out. And we see these distractors and how this unhealthy lifestyle practices going to contribute here. So again, if you are not doing any physical activities, this you can make out obese. You are eating junk food. Again, your life. You don't have proper time management. Again, you don't have control over your social media habits. And this all leads to finally, if you have smokers, alcohol, substance abuse. And interesting point is note here, all these unhealthy lifestyle practices as healthcare professional, we all know, but still we don't have control over these things. And once you start teaching or saying your patients, do this, and if you are not only following this type of things, you are not going to give strong message to the audience or the common people. And same times, you are not going to be effective at your workplace. Now see this picture. By seeing this, what you can make out? These physicians look like disorganized, anger, frustrated, obese. So do you like such type of personality? No. Whatever knowledge he has or she has, if such type of person will be there, the person is not organized, person is not disciplined, person will show such type of exterior, no one will like this. So it's very important to be focused to achieve your goal. So what is important tips? Just I want to tell you, make an effective and feasible routine or plan. Classify and prioritize your task, what you want to achieve. Just you discuss like short term, mid term, long term, daily basis, weekly basis, monthly basis. You should know what you are going to achieve. In between, you review it, how is going. Limit and spotlight your task. What is important at that time, we have to be focused and we have to do that. Do one thing at a time. Identify distractors, what I told you, and keep in mind and be very strict, be very disciplined to zero tolerance for your distractors during your study or working time. If you are too much distracted, you start with a small thing, like for 30 to 45 minutes, you can say that, yeah, I'm not going to distract, I'm not going to use my social media, I'm not going to use my mobile. I will be only focusing my work for 30 to 45 minutes. And slowly, you can achieve more after that 1 hour, 1.5 hours, 2 hours, like that. So start with this, and then you achieve and reach to your final target. Take a short break in between and do that whatever you want to do in between. Again, we are going back to your work, you're going for your study. Don't tolerate any distractions. And very, very important, follow healthy lifestyles. So again, we all know about this. We have to eat healthy, we have to do regular exercise, we have to create positive environment to reduce the stress, drink plenty of water, and we have to be confident enough. Again, once we ask this about our professionals, again, same thing. Most of us, we don't follow healthy lifestyle. And again, same time, we expect our patient, we expect our common people to do so. And it's very disappointing because we are not taking care of ourselves. So we are not giving the correct and powerful message. This is very important slide for me, the 3 wise monkey. Don't see anything, whatever is not going to contribute to you, is going to distract you. Don't see that. Only hear positive thing. Don't hear anything, whatever again going to disturb you and going to harm you. Don't talk anything going to create disputes, arguments, or whatever things, whatever is not good for your relationship, your aim, and your profession. So very important. see only good thing, positive thing, hear only good and positive thing, and talk only good thing. Okay, so there is a lot of things to learn from these three wise monkeys. And at any cost, we have to say no to this, because they are not going to contribute anyways to good health and happy life to you. They are going to only disappoint you, distress you, and further, we know all complications about all those things. So generally, how we start our day. It's very important when we start our day, start with the positive environment, start with something good. Because if your starting is only not good for the day, whole day we are going to be a mess, we are not going to be disorganized, we are going to be stressed. So generally, this point I have taken from the Miracle Morning. So what I suggest, generally we have to get up at least 2 hours before your work. Like if your work is going to start by 9, at least you start by 7 a.m. And start work with your silence. Start your day with silence. Meditation. Try to feel the nature. Try to see what is happening. Okay, so just be calm, cool. If possible, do meditation and try to keep yourself cool and calm. Then start with the affirmation. Affirmations means, again, whatever you want to achieve, try to write down, try to repeat those affirmations. I want to achieve this, I want to achieve this. You say, you try to repeat that. And visualization. Try to visualize whatever you want to achieve. Like you want to become a good, competent clinician. You visualize that already have become that competent physician, and people are coming to you, your friends are referring patients to you, you are going internationally, nationally, different places to train people, people are coming to you to train, something like that. So try to visualize this already you have achieved that. And exercise, very, very important. At least give 1 hour to you to go for exercise. If you can't do proper exercise, at least go for a walk, okay? And read. Reading doesn't mean that you are going to read your core subjects. You can read whatever you like. You can read something like it's going to contribute to you, contribute to your passion, contribute or make it you positive, make you energetic. Anything, whatever is contributing you, read. And after that, whatever you felt after throughout, what you have to do, what was your day, what further you want, whatever is coming to your mind, try to scribble, try to write it down. So generally we use the term scenarios for that. Silence, affirmation, visualization, exercise, reading, scribbling. So then if you see further, you say you don't have time for that. So remember, you have to manage your time. You have to work smartly, and you can make out these eminent personalities of the world. They are taking time for their health. So we can somewhere manage, and we can also take time for ourselves. This important point is, if you take time for yourself, if you communicate to you, if you talk to yourself, you will know what you want, and accordingly, you will be a better personality, and you can do work better way and effectively. And this is in the lighter mode. You have to understand the meaning of the true thing. Like doctor has asked her to go for, again, gym, and she is spending at least 1 hour per day on the treadmill, and see how she's spending time on the treadmill. So we have to know the essence of the whole thing. So just I want to share some practices, what we do at KMC Manipal to our students to be focused and take out from them, deviate them from their distractions. So we have something called teacher guiding scheme. So here, just so I imagine, or I want to give you an example, like first year MBBS student has come to the campus. So he doesn't know, she doesn't know how to go about it, whom to approach it. So this teacher guiding scheme is very effective for the freshers, especially. So here what we do for one teacher, we depute 8 to 10 students. So every student will get one mentor that acts like a teacher guardian for that student. And the students can approach that, even parents can approach them, and that teacher guardian will be responsible for overall development of that particular. And nowadays you can make out this CBME curriculum. NMC has also proposed the foundation course in outcome modules. It's very, very effective. We were doing since long, but now we are doing it more structured way. So this foundation course and outcome module is again very useful to students who are coming to the campus, medical campus. Generally what happens, as for entrance point of view, if you see, we only used to check their knowledge. We don't check their skills, their attitude, if they really want to be in medical schools, if they want to be a practitioners. We don't know that. We don't know this. Only we just check their knowledge, that also in the MCQ. We don't know how a person is going to reflect, how the person is going to think. We don't know. We don't have any things like that. But this foundation course and outcome modules, what they do, they will give comfortable environment to the students to think, to relax, to settle down before we'll start anatomy, physiology, and biochemistry. So here we teach about stress management, time management, yoga, meditation, how to communicate, what do you mean by patient, what do you mean by a doctor-patient relationship, and students will like this. They take time to get settled down. Otherwise, it's very difficult for the students because they're coming from different backgrounds, different way of their learning instructions, different language. And once they come to the schools, medical schools, they will be like the total, whatever they thought of is totally different, especially the students who are coming from somewhere, there is no one to guide them. So this foundation course and outcome modules are really, really very good for the students to make them comfortable and to start their career in the medical schools effectively. We have also student counselors. Sometimes we need some specialized professionals things we used to send to the student counselor. We have a student clinic also. If there is any health issues students are facing, directly then go to the student clinic, and student clinic will take care, and they will finally pipeline and streamline the whole process without any fuss. We have also a student support center. This student support center is basically completely confidential service devoted to supporting the emotional well-being of the student. And it is like something outside of the hospital environment. The students will feel comfortable to go and talk to the professionals if he or she has any emotional disturbance. We have also a student activity center. So again, other than their academic things, we also encourage our students to take break and pursue their passion, their hobbies, and they can do this near the student activity center, whatever we have. We have various clubs as per the choice, and they do their activities. We also encourage our students to work on their health as per their body, their mind, and they should at least practice yoga and meditation. We have our indoor sports complex that we see marina, and here we have almost all facilities to walk on it. So I'll show you the picture of this marina. So this is our 6th floor indoor complex. So here students can come and practice almost all games here we have. So as per the choice, if they don't know the games, at least they can further learn and play also. So we can make out here some photographs I want to show you. This is students. Here we have some event for cultural. So also encourage our students to focus their also co-curricular and extracurricular activities that makes them again be positive and confident other than their whatever routine life. So overall, if you say some take-home message, my the whole presentation is what we have to focus on your goals, not your fear. With this, I will conclude my presentation. Thank you so much for the opportunity given to me. After this, I will invite Dr. Samir sir to give his more valuable insight on the same topic. Over to you, sir.
Yeah. So good afternoon, everyone. Thank you, Dr. Arvind. Yeah, so I will spend around 10 minutes just focusing on one or two things. You already heard Dr. Arvind. He spoke in detail about how to stay focused. So essentially, joining a professional career, it is something very different than any other career, I would say. So I hope you understand what is a professional, which requires a lot of commitment as compared to many other jobs that I can say. Also, there are a lot of challenges if you join a new profession. So there are a lot of ground realities. So we all see the rosy picture from outside. We don't know what is in there. So once you join a professional course, you actually get to know a lot. So there are positives, there are negatives as well for each profession. Same for medical profession. So once you see those challenges, the realities, so you need to come to terms with them. And of course, everyone has their own goal. I think we're discussing about goal setting. You need to have a goal. So people join medical profession with a goal in their mind, isn't it? So you want to help people, you want to, whatever. I mean, maybe earn money, get respect. So do something for the society. So you have your own goals. Also, there are expectations by parents. So when they want to see someone as a doctor, or maybe even your teachers who expect you to see in a particular role. So a lot of expectations from others which are there. Also, we need to be aware about our own capabilities. See, not everyone is same. So some person may be good at something, some person may not be very good at certain other aspect. So we need to be aware about own capabilities. So if you don't know, so that can be a challenge. Also, when you get into a competitive mode, you want to excel, isn't it? You want to be better than others. So that will lead to a lot of competition, and then it's not only the wish to excel, but the will to excel as well, whether you want to actually do it that particular way. And it will all depend on stress and emotional maturity of a particular individual. There are all the challenges that we. So we discussed a little bit about stress and how to handle it. So this is important because when people join into these professional courses, usually they are still in the developing stage. So they've not yet fully matured, so to say. So not everyone would have actually achieved a lot of emotional maturity. So that again is contributes to the challenge. You need to understand what is stress essentially. Whatever you do, whatever said and done, you cannot avoid stress. It's part of life. So there are ups and downs everywhere. What is more important is not how much stress one is facing. Of course, I mean, someone is facing a lot of stress. They may not be able to handle it, and there could be problems. But people actually tend to cope with this. They tend to sort out the problems, take help from others. So actually, the more you, let's say, cope with these kind of stressful situations, more will be the growth. So you learn things, you make mistakes, you learn things. So it is not just the stress per se, but how you look at it. So if you see a stress as an opportunity, let's say you learn something from that, you will do it in a positive way. You try to handle it and get over this one. So our view of the stress is more important. Our appraisal of the stress is more important. So how we feel after that, whether we feel happy, whether we feel sad, whether we feel fearful, anxious. So there are many types of coping. So some people cope in a very positive way, which is more constructive, more positive. Sometimes people cope in a negative, unhelpful way. So we need to identify that, and we'll see what we can do about those. So what are the sources of stress? There are many different sources. You can say there are conflicts in mind. You want to do this, you want to do that. We don't know, not able to decide. That can be a source of conflict. Daily hassles. I mean, you start in the morning, whether to have breakfast, what to have, where to have, how do you commute. So all those small problems also contribute to the stress. Problems related to work, related to finances, many other factors which will be there, problems in relationships, changes in life. I mean, someone starting from, let's say, college life to a more professional kind of courses, the transitions, these all can contribute to stress. Specifically in students, we discussed about different standards which are there. The studies are suddenly more, so you don't want to fail, you want to compete with others. Time can be a problem. Difficult to sometimes manage because you need to study for long hours and you sleep late. These all can contribute to problems in students. Sometimes some students feel lonely because of that. And of course, I mean, there are peer pressures. So some people are trying to experiment something, do something new. You want to join that. You're missing family. Some people would be staying in hostels. The lifestyle that you used to enjoy back home would not be there. This is something that we see in most of the campuses when people are staying in hostels. Even some people may not like the actual living arrangements. I mean, maybe the hostel rooms are not good. The food is not good. It's a new culture, new place. Language is different. So many problems can be there which students face. But most people actually learn over a period of time, let's say given 6 months, 1 year, people learn to cope with these problems. They just need little time, maybe a little bit of help, help from friends, from support from family or from teachers. Most people learn. However, some may cope in a very inadequate way. So I'll just bring out certain things, why this happens. So successful coping, if let's say if you identify the problem, you try analyzing it. So you think, you don't react. So if there is a problem, so what kind of problem? Try describing the problem, analyze it carefully. Think through the possible alternatives. So 1, 2, 3, 4, these are the 4 solutions which are there. See which one is appropriate, which one is good, which one is not so good. Try to seek help from others. You choose option A, follow that, see whether it is working or not. It's not working, go back, try plan B. So that's the usual stance. But what happens is many people don't think that way. So they just act, they react. So immediately without thinking, if you just act, so sometimes you'll take a wrong decision and that can lead to more problems. So I'll tell a little bit about that too. So actually, certain things that are needed, specifically when you're in hostels. So I have a regular contact with someone, a parent, guardian, a good friend. So teacher guardians like Dr. Arvind was talking about in the campus. So that also helps. Have a network of friends and immediately seek their help. And also, you need to seek help if there are other kind of problems from teachers or maybe other kind of services like student support services, or if needed, even for professional help from doctors as well. We discussed about this physical activity, regular exercise, which is actually very useful. So it's not just for physical fitness, it is also for mental fitness. So any kind of regular exercise is something that you should be doing. Some sort of hobbies in a very planned way. If you're religious, practice your religion. If you're spiritual, practice spirituality, yoga. Have a regular schedule for work, for play. Any small problem appears, you try to solve it then and there. If you keep on, let's say, postponing it, they keep piling up, and then in the end, it becomes a problem. And of course, time management is something which is very important. You need to learn. You can have a schedule. The problems, if it goes out of hand, sometimes some people, they say, okay, I'm not going to handle this thing. They're not motivated to work on a particular schedule. You have made a schedule, but not able to follow that. Poor concentration, memory, attendance is falling, not able to attend classes. Other symptoms appear like anxiety, feeling sad, sleep problems, body aches. These are the times when you should look for professional help. So other signs like someone you're not able to mix with others, you're not going for your classes. So maybe getting into unnecessary kind of relationships, not maintaining good friends, maybe getting into circles which are not so good, unhealthy eating style, not sleeping in the night properly, unsafe sexual behavior, substance use, again, another problem, internet, excessive use of internet. So we're not coming out of games and other things, including porn and other stuff, which once in a while is fine, but then if it is more, it can cause problems. So if I identify something like that, immediately seek professional help. Substance use can be a problem. It starts with experimentation. You just experiment, then maybe get into that habit. So peer influencers are important. Media pressures, you see actually advertisements and then you feel, okay, this is one way to solve our problems, but it doesn't actually. So you feel more isolated, develop other kind of psychological problems. And the consequence, again, there is a loss in health, academic problems, poor self-esteem. So you don't feel happy, feel good about yourself, which leads to actually further substance use. So this is a cycle actually which continues. So if you're aware about this, you should be able to get out of this. Many times the person himself is not aware and need other persons to point out, okay, so these are the problems you're getting into. So you should get out of this. So what can you do about it? So first is avoid any experimentation with substances and avoid friends who actually use substances. If you do this, probably you're not going to get into this problem. In the end, just want to say that, so be regular with your work, participate fully in whatever activities that you do, whether be it studies, be it games, plays, whatever you do, make some lifestyle changes. So it's not just studies, but you need to look into physical activity and other stuff. So manage time because that helps. Stay in touch with your family, with friends. Avoid undesirable company or risky behaviors. This will distract you. We're discussing about different distractors. So reach out for help early. So even if you are feeling little problem, no, don't wait. So you should go for a professional help. And I would suggest every one of you, because it's not very easy to identify a problem in yourself, but it is easy to identify in another person. So look out in your friends. If someone is going through this kind of problems, help them. You can refer them to someone, take them to someone where they can get some sort of professional help. So I'll stop here. Thank you. We'll take up any questions, anything if you have.
So thank you, Dr. Arvind and Professor Samir, Praharaj, for this very kind of intriguing presentation about how to stay focused in life. Dr. Arvind has talked about how to set your goals, how to kind of make your goals, how the goal should be, and what should we do to achieve those goals in our life. While Dr. Praharaj has focused more on something which affects our day-to-day life, stress management, coping skill. How do we kind of cope with our daily life stressors, and how not to kind of experiment with substances, and how it can actually help you in your day-to-day life. So thank you, both the speakers. After this interesting session, we have some interesting questions also. It's suggests that our audience was kind of focused on your lectures and they were listening to you, whatever you were saying. So let us start with the question by, the first question is by Asra. And the question is for you, Dr. Arvind. She wants to know something about skills to maintain a good sleep hygiene, something really important in our day-to-day life. How do we maintain a good sleep hygiene with so much of stress around in our lives, and maybe so much to read, study, so much to do? So how do you suggest Asra about that?
Yeah, generally what we suggest to our students, maybe Samir sir can add on later. Thing is, we have to follow a healthy lifestyle. Healthy lifestyle means what we have to do at least 2 hours before your plan to sleep. You should not use any distractors things like mobile. Nowadays, you see the younger students. Whatever your social media, mobile, TV, just we have to say no at least 2 hours prior for your sleeping. And make a good habit, at least 6 to 8 hours we have to sleep. So what we have to do, we have to we're going to sleep by 10 o'clock. So maybe by 9 o'clock, you should stop such things. Okay. And then again, same thing, alcohol, your substance abuse, your whatever, the tobacco, and whatever is going to distract you. If you take care of such things, what happens? You automatically, your time, your health, and your mind will start working, and whatever you want later, it will be fall in place. Samir sir, you want to add something?
Yeah, I think thanks. You already said that. I just want to add 2, 3, 4 quick points. So regular timing is important. So sleeping time, waking up time. I would stress more on the waking up time. If you keep that fixed, so your sleeping time automatically falls into place. So if you, let's say if you have classes or something at 8, maybe you want to wake up every day at 7 or 6, keep that fixed. Second thing, don't use any substances in the evening, maybe caffeine, alcohol, smoking. These actually will disrupt sleep. Third thing, don't take anything to bed, like Dr. Arvind said. So mobile phone, gadget, everything, anything that will keep you awake, don't take to bed. Bed is only for sleep. So, okay, so if you're feeling sleepy, go to bed. If you're not feeling sleepy, sit down on your table and chair, do whatever work you have, finish that off, then go to bed. Don't watch TV or do anything which will keep you active. So these are few things that if you're not feeling sleepy, you can always get out of bed, take a stroll, wait for some time. Once you feel sleepy, go to bed. Don't take daytime naps. That is not needed at young age. So sleep only during night time. So that is how sleep hygiene works.
Thank you, Dr. Arvind and Dr. Samir. So we have another question by Aparajita. Her question is, 3 wise monkeys is a very good suggestion. So this question is to you, Dr. Arvind. But what can we do if we are a student and our teacher and his attitude is inclining more towards negative towards us when we have to attend the lectures for an entire year? So something tricky.
Yes. See, that's why I told you something nowadays, this pandemic time, you can't avoid such things because a lot of classes going on online and VR. But at the same time, you know how many people are active on the online for the learning purpose. That also is very important because what you have seen our residents or things, just they will log in after that. They are not there on the screen. They are not listening to you. Yeah, but it's important. You have to reduce your screen time. So it's not like possible in one day if you're full much addicted to mobile, social media, and suddenly we'll say tomorrow you're not going to stop this. It's not going to work. So that's why I told you in my presentation, make your schedule, like 1 hour, whatever I'm going to study, 45 minutes I'm going to study. I'm not going to use my any gadgets. I'm not even touch my any social media things. I am going to stay focused for my only study. And after 1 hour, go and check your things, how many likes you got. Who has again posted something. So only 15-20 minutes you can come back to study. Like that, you can increase your timeline for that, and it will helpful. So basically, we have to practice to strong and make healthy your mind along with your body, and we have to have full control over your willpower. That is important to achieve such things and to avoid distraction. Yes, sir.
Thank you, Dr. Arvind. So another question we have, I think the question is by Shiba Nayak, and her question is not specific to any of you. Any one of you can answer that. Can we ever train an adult on how to behave or communicate? It is an individual's character and something inculcated since childhood. So any of you would like to answer, sir?